Can an intraocular lens fix my refractive errors? Imagine waking up and seeing clearly without glasses or contact lenses. That's what some people hope for when considering intraocular lenses. These tiny lenses are designed to help correct common vision problems like nearsightedness, farsightedness, and astigmatism. They are most often used during cataract surgery but can also be implanted in eyes without cataracts to improve vision. Intraocular lenses work by replacing or supplementing the eye's natural lens, which is responsible for focusing light onto the retina. When the natural lens becomes cloudy due to cataracts, or when it has a refractive error, these lenses can help restore clear vision. There are different types of intraocular lenses tailored for various needs. Standard lenses are used during cataracts removal to replace the cloudy lens, and they can be chosen to correct some refractive errors at the same time. Toric intraocular lenses are specially designed to correct astigmatism, which causes blurred or distorted vision due to irregular corneal shape. These lenses can significantly improve visual clarity and reduce dependence on glasses after surgery. For patients with high refractive errors who are not suitable candidates for laser, eye surgery, phakic intraocular lenses are an option. These lenses are implanted without removing the natural lens, providing a way to correct severe nearsightedness or farsightedness. Studies show that these lenses can greatly improve uncorrected visual acuity, meaning you can see well without glasses or contacts after the procedure. Advances in technology have led to the development of light-adjustable lenses. These lenses can be fine-tuned after surgery using controlled ultraviolet light, allowing precise correction of residual refractive errors. Most patients with these lenses achieve very accurate results, often within half a diopter of the target correction, and enjoy excellent uncorrected vision. However, it's important to remember that the success of intraocular lenses depends on careful preoperative measurements. If the calculations for lens power are off, some residual refractive error may remain, which could requiring additional procedures or lens adjustments. Outcomes can vary based on individual eye health, the severity of the refractive error, and other factors. Patients with certain eye conditions like glaucoma or macular degeneration may not be ideal candidates for intraocular lenses, and their expectations should be discussed thoroughly with an eye care professional. While intraocular lenses are a proven and effective way to correct many refractive errors, they are not a guaranteed fix for everyone. The best approach is to consult with an ophthalmologist who can evaluate your specific eye health, discuss your goals, and help determine if this option is right for you. Remember, each eye is unique, and personalized care is essential for achieving the best possible vision.